Good evening, everybody. I'm Brad Means.
I'm Jenny Montgomery. Thank you so much for joining us tonight. Coverage you can count on begins with local reaction to President Trump's plan to eliminate the HIV epidemic in the United States within 10 years. News Channel 6's Renata Dubose has been covering this story for us today, and she has local reaction to the plan.
Jenny, thanks. The state of Georgia, and in particular the Augusta area, has dealt with high HIV and AIDS numbers for years, especially since this is a transient community. Now, last night's State of the Union address did not outright mention a cure, but President Trump does talk about funding a plan to end the epidemic or new HIV infections, something we're seeing right here at home.
Georgia has more new HIV infections.
A new call from the highest office.
We have made incredible strides, incredible.
President Trump told the nation it's time to eliminate the HIV epidemic within 10 years.
This is a very, very important initiative, and it's really got a very good chance of working if it comes through.
Trump's plan is tied to the 2020 budget with a goal to reduce new HIV infections by 75% in 5 years and 90% by 2030. Between Richmond and Columbia counties, nearly 80 HIV cases existed in 2017. Most throughout the district were black gay men in their 20s. Dr. Roger MacArthur says Trump's call to fund public health workers in communities will reach those at risk.
We have a lot of infections occurring in rural areas. We've got a lot of infections here in Richmond County.
Maurice Stevens has fought HIV for many years. He agrees that these workers are needed.
Giving the information to people who are already HIV positive is sort of like we need to get the information to the people who aren't or may be positive that needs to be tested.
Stevens says he's been living with HIV for 31 years. He's fighting other unrelated illnesses too and is a recovering drug addict. He says because his family did not stigmatize him, coupled with taking medications on a regular basis, he has better health.
After I addressed my drug addiction, I was able to start consistently taking my medicine the way the doctor prescribed. Now I'm undetectable.
And though he agrees with the message, Stevens says he's unsure about the messenger.
But is he sincere? That was my immediate action.
Now, tomorrow marks National Black HIV/AIDS Awareness Day. Brad?
Renata